Hello everyone, I'm Karen Yomo, currently working in Prince Sultan Military Medical City, Riyadh, Saudi Arabia. I'm here to discuss about de-escalation. As a nurse working in psychiatry, de-escalation is very important with us. So I want to share with you a few points using the de-escalation. I'll be presenting to using the PowerPoint. And hopefully, guys, you will learn something from it. So let me share my screen. Okay. So de-escalation. Our goal today is to enhance the knowledge and practice on interventions required when using de-escalation techniques on disturbed patients in psychiatry ward. Our objective is at the end of this lecture, the participants will be able to improve the understanding on the theoretical aspect of de-escalation. This theory will not teach you how to do hostage negotiation skills, how to break up fights, physical intervention techniques, how to do judo takedowns, or anything else that might get you hurt. Theory is a theory. So have you ever felt threatened? Did someone shout out you or pick a fight with you or pointed a gun with you? So how do you know when you are being personally or physically threatened? You will know it when it happens to you, of course. You will feel it. Trust your instinct. So what are the warning signs? Generally, patients who are aroused to fight do not launch into assault for fear of injury. They initially begin by using attack gestures known as ritualized combat. So what are these signs? These include direct contact, eye contact, kicking the ground, accelerated breathing, and patients stand tall to maximize their height. What are the danger signs? So these are more than warning signs. Patients begin to lose control physically. When this occurs, their physical signals are significant and spontaneous. The signs include are fist clenching and unclenching, facial color pales, lips tightening over teeth, and shoulder tense, and they will change position from square to sideways. Physical force. Use of physical force is never recommended. Physical force would only be used as a last resort to prevent injury to yourself or to another person. Use of physical force usually results in someone getting hurt. So are your response to aggressive patients reasonable and justifiable? So remember, no one is above the law. So you need to ask yourself, you need to assess yourself. There we have necessity and proportionality. So what are the escalation? Who needs the escalation training and when might you need to use the escalation? The escalation is used during a potentially dangerous and threatening situation in an attempt to prevent a person from causing harm to themselves or to others. The escalation consists of tactics to help limit the likelihood of being injured on the job. Who needs the escalation training? Of course, everybody needs it, especially health employees, as they are likely to come into personal contact with clients who are emotionally distressed. The escalation tactics are non-physical skills used to prevent a potential dangerous situation from escalating into a physical confrontation or injury. Tactics have four main categories. First is tactics used to prevent a potential dangerous situation from escalating. Tactics used to de-escalate a threatening situation. And these tactics used during a confrontation to ensure your personal safety. And the last one, this is used to evade or escape from an attack. When you might need to use de-escalation with patients who are out of control, with visitors who are out of control, with an injured person, with a violent patient, and whenever you feel threatened. So, our communication sometimes matters in the escalation. Our nonverbal cues, this is our 70%. And our verbal cues are 30%. 5% of our words actually words spoken, phrases, and content. And the 25% of it is our tone, volume, pitch, and inflection. So the escalation, verbal skills are 30%. So we need to learn to manage our pitch, our tone and volume, empathize with the situation, acknowledge and check feelings, distraction, and start negotiations. Use of your voice. So be aware of your tone, again, volume, the rate of speech, and inflection of your voice. So a lowered voice level may set a tone of anger, which could create fear or challenges. A raised voice or high tone of voice may set a tone of anticipation or uncertainty, which may promote excitement or disruption. Speak slowly. This is usually interpreted as soothing. A controlled voice is one of calm and firmness, which promotes confidence in both parties. Humor may unintentionally offend someone and escalate the situation. So use humor sparingly and always direct humor towards yourself. Be very careful when attempting humor in this type of situation. Always be respectful to the other person. Using please and thank you, Mr. or Miss, indicates respect. Inflection of voice examples. What do these words mean if you are the listener? If I will say, I didn't say you were stupid. It's like I'm saying really that you're stupid. Or, I didn't say you were stupid. It's like your brother or your sister said it instead, not me. Or, I didn't say you were stupid. Like you're saying, but I didn't write it in the bulletin board. Or, I didn't say you were stupid. Like somebody else told that you are stupid. Or, I didn't say you were stupid. Like you're saying that I said you were a complete idiot. So be careful with our inflection of voice. Sometimes our listener might different understanding. So the escalation techniques, some techniques are simple listening only, distracting the other person, changing the subject, refocusing the other person on something positive. Use humor, as I've said a while ago, sparingly only to lighten the mood. But be careful with this because sometimes they will misinterpret it. Motivating the other person, empathizing with the other person, and giving choices, and sometimes setting limits. De-escalating positively, use positive and helpful statements such as, I want to help you. Please tell me more so I better understand how to help you. Let's call Dr. Smith. I know he will be able to help with this. Put yourself on his or her side of finding a solution to the problem. Listening. 3 main characteristics of listening skills. Attending. Giving your physical and mental attention to another person. Following. Making sure you are engaged by using eye contact. Use unintrusive gestures such as nodding of your head and saying okay or asking an infrequent question. Reflecting, paraphrasing and reflecting using the feelings of the other person, or this is we call empathy. Listen when you are listening. No other activities when listening. Multitasking is not good when you are listening. What is the difference between hearing and listening? So as I discussed, listening is we will not do anything just to listen, just listening what they're saying. So the escalation, nonverbal aspects is equal to 70%. We have an acronym here, PERFECT, which is P is the proxemics. This is your space with your client or with your patient. Using your eye contact, respect touch boundaries, facial expression, environment, consider influence of your appearance, and think about your hand movements. Body language. Finger pointing may seem accusing or threatening. Shoulder shrugging may seem uncaring or unknowing. Jaw set with clenched teeth shows you are not open-minded to listening to his or her side of the story. A natural smile is good. A fake smile can aggravate the situation. Use slow and deliberate movements. Quick actions may surprise or scare the other person. Keep your hands visibly at all times. You do not want the other person to misinterpret your physical actions. So, body language using our eyes. One eyebrow raised. Of course, it's not good. It means sternness. Eyes open wide. It's like you're surprised. A hard stare means that threatening gestures. Closing eyes longer than normal. It's like I'm not listening at all. Personal space, this is 1.5 to 3 feet away from your client, far enough away so you cannot be hit or kicked. Do not touch a hostile person. They might interpret that as an aggressive action. Challenging posture, these are postures that tend to threaten another person and escalate any situation further. It's like face to face, nose to nose, toe to toe, eyeball to eyeball, touching and finger pointing. Protect yourself at all times. While de-escalating another person, you want to be in a non-threatening manner, non-challenging, and self-protecting position. This is the pyramid stance that you can see in the picture. You can see in the picture that it should be open palms always. Because if you close your fist, it's like you're in an aggressive posture as well. So additional tips, you should remain calm, listen, and really listen. Avoid overreaction, validate. I understand why you might be upset. Remove onlookers or relocate to a safer place. Onlookers can become either cheerleaders or additional victims. So send an onlooker for help. Watch for nonverbal clues or threats. Bring in another trained person to assist whenever possible. There is less chance of aggressive behavior if two people are talking to one person. What if someone really become aggressive and they have a gun and they're ready to fight? So what will you do? Of course, you need to call for help. Alert someone else as soon as possible. Shout for help. No help will arrive until someone else knows your situation. Until then, you are all alone. So remember, two heads are always better than one. There is safety in numbers. It will be beneficial to have a witness if the situation deteriorates and someone might get injured. Notification and follow-up. So assess for injuries, counseling and debriefing, document, always document and document. Because this might and this will save you in the future. And of course, report any untoward incident. So the more emotional we became, the less rational we are. So avoid becoming emotionally involved. Control your emotions at all times. Thank you so much and have a nice day, everyone.